Namaskar and welcome back on week 3 of the course on Yoga for Concentration. This course is developed by Swami Vivekananda Yoga Anusandhana Samsthana, a deemed to be university dedicated for yoga education and research, making yoga a socially relevant science. This course is developed for Swayam and is supported by All India Council for Technical Education, New Delhi. We have so far learnt about what concentration is, what attention is, what are the different types of it, and what goes on when we are trying to concentrate in our brain. Today, we will be learning about what problems can arise, what are the kind of disorders that can happen when one wants to focus their attention or concentrate on something. Let us begin today's session with prayer. तत्रैकाग्रं मनः कृत्वा यतचित्तेन्द्रियक्रियः उपविश्यासने युञ्जात् योग आत्मविशुद्धये. As explained by Sri Krishna Bhagavan in Bhagavad Gita, concentrating the mind is one of the most important steps in the path of spirituality and yoga, which is explained in this particular verse. So today we will be talking about the different disorders that can affect our attention and concentration. The learning objectives for today is to understand about the disturbances that one can have in attention and concentration, and to learn in detail about the disorders of attention and concentration. So one of the first things that we will talk today is about mind wandering. This is not actually a disorder. It is something that we experience almost on a everyday basis. It's a common phenomenon. Okay? This is basically the inability of anyone to focus on a single object or task at hand. It so happens that you want to do something, okay, and you sit, but you are somehow not able to concentrate. You want to study, but your attention is going everywhere. That is exactly what means by mind wandering. So this is basically when individuals' thoughts shift away from the task at hand. You might be sitting in front of a computer trying to make a presentation, but in your thoughts you are thinking about a holiday, going on a beach and relaxing. Okay? So it is basically defined in 2006 by two scientists called Smallwood and Schooler as the task unrelated thoughts. You are thinking, you are supposed to think about something, but suddenly you are having thoughts which are absolutely unrelated to what you wish to achieve. It is a common everyday experience where attention becomes disengaged. Okay? So we want to focus and do something, but you are disengaged from that activity and from the immediate external environment as well, and it is focused on an internal train of thoughts. Basically, you might have experienced this. Couple of friends or siblings sitting together and chatting about something, you start discussing something, okay? And from there, you go on talking for hours together without realizing that the topic that you're talking now is absolutely different than what you began with. It is like a chain of thoughts, one leading to another, because we are reacting to the first experience and then going on and on and on. But basically in this process what happens is we forget what we have started with. The task at hand is lost. So how common is mind wandering? Actually, there are studies done way back in 1961 by Singer and McCraven, who said about 96% of the American adults experience mind wandering at least once every day. So it's actually very, very common. Okay. Further, there were experiments done by Klinger and group in the early 1990s and the 2000s, it said that it occupies up to 50% of a waking day, which is a significant amount of time considering that we sleep for about 8 hours a day. Out of 16 hours that we are awake, about 8 hours our mind wanders here and there. We are not able to focus. And imagine if we are able to do focus on something during that time, how productive we could have. Some common synonyms for mind wandering, in colloquial language is daydreaming or fantasy. Sometimes we talk of zoning out. You're doing something and suddenly you forget what you're doing and you're thinking about something else. Or the task irrelevant thoughts or the unconscious thoughts taking over. So mind wandering is actually a very common phenomenon that is experienced by almost everybody in a regular day-to-day activity. So what are the reasons of mind wandering? A few of the common reasons is simply getting bored. You are doing a particular activity and after a point there is no novelty to it. You start getting bored and then suddenly you forget what you're doing and you're thinking about something else. It happens when people are driving for a long distance. They get bored of doing that and then suddenly they want to look at their phones or they want to play some songs or something like that. So boredom is one of the most common problems with mind wandering. Also fatigue. If you are tired and you want to focus, your mind is going to wander. And that is why generally when you want to achieve something, you want to prepare for an exam or make a presentation, you usually tell yourself that you want to start when you are fresh and not when you are tired. Okay? Also, mind can wander because there are distractions. A lot of distractions in the environment can take you from one point to another, and that is basically because our ability to inhibit these experiences, the distractions, is what is getting failed. There is failure of cognitive inhibition, and during this kind of a situation there is a particular area in the brain or a network of neurons, the cells in the brain, which is called as default mode network. Now, what is known by science today is whenever there are people undergoing or experiencing mind wandering, this particular part of the brain that is situated in the parietal cortex as well as the frontal cortex, the default mode network is very active. Also, studies have shown that mind wandering has a very strong association with negative emotions like anxiety, depression, and so on. And therefore, what we need to understand is if you want to reduce mind wandering, you want to reduce the negative emotions, you want to reduce the distractions and have novelty in what you want to do. When those things happen, the mind wandering is actually minimal. And there has been large amount of research in psychology where we have found that the mindfulness and mind wandering are two opposing psychological phenomena. What is mindfulness? If you recall, we have already spoken about it. It is being in present and experiencing whatever is around you and not being judgmental about it or not being reactive about it. While the mind wandering is all about not being there. You are in a particular situation but you are zoned out. You are not anymore thinking about it. You could be in a beautiful park looking at trees and a sunrise, but at the same time thinking about presentations and traffic and whatnot, problems at home. What is also known is yoga practices have been demonstrated to reduce the mind wandering and enhance mindfulness. And therefore, we can actually start focusing better, we can have better attention and concentration if we practice yoga. And one of the ways by which yoga is going to help is by reducing mind wandering. Having spoken about mind wandering, now we will talk about a very common health problem called attention deficit hyperactivity disorder, or in short it is called as ADHD. It is a very common problem today among children, and as the name suggests, there is reduction in attention and there is hyperactivity as a result of it. So basically what is seen is some children in a school take a lot longer time to complete the task. Okay, they are unable to focus in a classroom or learning. They easily get distracted. Okay, and these have led to a condition called as ADHD. ADHD is usually a disorder of childhood, but it is not limited to children. It can also be seen in adults. Okay, the people can have ADHD as children and they can continue to have it when they grow up. If you are looking at how common is ADHD, the prevalence, it is fairly common among children. Worldwide, it is said that about 7 to 12% of children suffer from ADHD, and that means about 10% of majority of children have this problem. Okay, and we will talk about what problems these children face in just a while. What is also seen as a result of research is majority of the children who have ADHD are males, about 66% of them, and it is less common in female. It is also seen that the low socioeconomic groups have a higher percentage, about 16%, which is way higher than about 12% of the global prevalence of ADHD. The Indian studies actually demonstrate that in India the prevalence is about 6%, and interestingly in India girls demonstrate ADHD more than boys. Now the reasons are very much not known, but that is how common this health problem is. So what happens when a child is suffering from ADHD? Because they get easily distracted, because they are not able to focus their attention, concentrate on something, it commonly affects learning. These are poor learners, okay, and require a lot more attention. There is also significant disturbance due to this poor learning in the childhood, and therefore it is very important that these children are not really punished for not performing well in their studies in the schools. Rather, they should be detected if they have a health problem, and they can be helped so that the problem gets solved very easily. So there are three kinds of ADHD problems. Okay, there are people who have predominantly inattentive people. There is a deficit in attention. There are predominantly impulsive or hyperactive kids, and then there is a combination of both. Okay, so what are the people or children who have predominantly inattentive behavior? It is hard for them to organize or finish a task, pay attention to details, or follow instructions or conversations. Okay, they get very easily distracted and forget the details of their even daily routine. So it is not that the child is doing it intentionally, but because they are going through a health problem that these signs can appear. Also, a lot of times children are said to throw tantrums, but that is also because they are going through a problem like predominantly impulsive or hyperactive. So they fidget or talk a lot. Okay, it is hard for them to sit still for a long period of time. They want to do something all the time, and a majority of children who have ADHD have a combination of both, lack of attention as well as a hyperactive behavior, and that is why the spectrum of ADHD disorders include the symptoms of both lack of attention as well as excessive activity. Okay, Now, this can cause several problems like being very disorganized, losing things, you don't really remember where you have kept something, maybe a book in a school or pen, okay. It is also leading to inability to perform well in academic aspects, even loss of jobs or impairment of social life, because you are not able to follow conversation, because you are not able to focus on the job at hand, you are not able to study well, because you are getting distracted very quickly, or you cannot sit and do the activity at hand. So these are the features of ADHD. Now, what causes ADHD? The exact cause is actually unknown, okay, but there are possible causes and risk factors that are been having strong association with the prevalence of ADHD. During birth, if there are brain injuries, the children are more commonly susceptible for ADHD. Exposure to environmental risk like lead poisoning during pregnancy, okay. So if the mother is having lead poisoning, or at a very young age the child has lead poisoning, sometimes that leads to ADHD, because that affects the activity of our brain. Also, if the expected mother is indulging into alcohol or tobacco in any form, it is seen that their kids have higher prevalence of ADHD. Also, ADHD is common in children who are delivered premature or have low birth weight, that is, they have lower than the normal weight at birth. So all these children are kind of having higher risk, but not that every child with such exposure is going to develop ADHD. Also, there are so many myths around ADHD that eating a particular food like too much sugar, watching too much of television, or bad parenting can lead to ADHD, or social or environmental factors like poverty or family chaos, etc., can lead to ADHD. But these are so many scenarios that may not be the causes of ADHD, but when they are there, they can actually exaggerate the symptoms. They can make the symptoms worse, especially in some children who are exposed to this kind of environment. So, how do we diagnose ADHD? There is no single test, you cannot just do an MRI or do a blood test and find out that somebody is having ADHD. There can be many other problems like anxiety, depression, sleep problems, or certain types of learning disabilities, something like dyslexia. They can have similar symptoms, okay? And therefore it is important that the child who is experiencing this kind of disturbances, unable to focus, having difficulty in learning, they are subjected to medical evaluation. So among the medical evaluation, it is also important to rule out problems of hearing or vision, because sometimes the poor learning can be because they are not able to hear well or see well, okay. Also rule out the other problems with symptoms like ADHD, that is stress, anxiety, depression, etc. So diagnosing ADHD usually includes a checklist of rating of ADHD symptoms and taking a history. So whenever you are going to a doctor or a psychologist, they are going to ask you questions, typically to the parents, sometimes to the teachers, and rarely to even the child who is affected. So the diagnosis of ADHD is actually made more of a symptom-based approach and with history that the child gives. There are studies that are done using fMRI. fMRI basically looks at your brain and looks at what parts of the brain are active or inactive during a particular phase. So when fMRI studies are done with ADHD, what is seen is children suffering from ADHD it is found to be having reduced blood flow to the frontal lobe. But it is not that you have reduced blood flow to frontal lobe, you will have ADHD. This is just a finding that is associated with ADHD. So what are the treatments? In most cases, ADHD is best treated by a combination of behavior therapy, and sometimes it requires medication. So counseling, meeting a psychologist and going through a therapy is going to be of great help. For preschool age children, say 4 or 5 years of age with ADHD, behavior therapy, also training of the parents, a lot of times parents get very angry or annoyed because the child is unable to focus. So it's important that the parents are also trained in how to handle these children. Okay, so the first line of treatment is actually behavior therapy. What works best can depend on the child as well as the family. Good treatment plans will include close monitoring, follow-up, and making changes if needed along the way. You can start with behavior therapy. If it doesn't work, you can add medications. You can talk to the parents, see if there is a problem in the relationships in the family, etc. But it is important that a child with ADHD is actually subjected to some form of therapy. Again, there are studies with yoga, which we will be discussing on a later part of this course, that help in children with ADHD. Also, it is important to develop a healthy lifestyle. Okay, a child with ADHD being healthy is going to be very important. So, in addition to behavior therapy and medication, it is the lifestyle that is going to make it easier for the child to deal with the symptoms. These behaviors could be healthy eating habits. Okay, you provide the food that is having plenty of fruits, vegetables and whole grain. So wholesome food is going to be very important. Physical activity, engaging in physical activity is very important. Children, when they are active, their brains are going to calm down. Also, today's problem is that we are exposed to a lot of screen time, and we will be talking about that in just a while when we are talking of the third problem that we will be discussing today. But limiting that screen time, the televisions, computers or smartphones or other electronic gadgets is going to help in managing ADHD better. Also, it is important that these children get enough sleep for their age. So when that kind of healthy lifestyle is adapted, definitely a child with ADHD is going to have much better results. Sometimes in adults as well, we find ADHD, okay, and this is typically, the symptoms are going to be different. It can be seen as difficulty at work, at home, in relationships. Symptoms may look different at older ages. That hyperactivity would appear like somebody is extremely restless, okay, and the symptoms can become more severe when there are more demands of adulthood. So therefore, it is important that we identify this problem and deal with it much early. Now, what are the other disorders of attention? There are so many, there can be confusions, they are unable to take a physical or a mental operation because they are unable to focus. One major problem that is in recent time is smartphone addictions, and we are going to spend some time talking about it. So what is smartphone addiction? The technology today has made things very simple. Okay, earlier you had to go to a computer and interact with it, but today the knowledge has been condensed in the form of a smartphone, an extremely productive tool. Okay, but sometimes it leads to a compulsive use. Okay, that is going to interfere with work, with school, with relationships. When you spend more time on social media or playing a game than you do interacting with real people, and you can't stop yourself from repeatedly checking the text, emails, or apps of social media, etc., then that is a danger sign that you probably require some help with smartphone addiction. So it is known as what is called as nomophobia. The fear of being without a mobile phone is a recently added disorder in psychology and is often fueled by the use of or overuse of internet and the internet addiction disorder. Rarely the phone or tablet itself creates a compulsion, but it is rather what applications are we using, what games are we using, or the exposure to online world it connects us to. These are the ones that lead to the form of addiction. The spectrum of problems with smartphone addiction can be online relationships are more valued than real people. Okay, we are too busy on social media than talking to real people who are sitting next to us. Okay, there is information overload. We get everything from outside. We doctors these days say that Google, if you want the diagnosis and treatment as per Google, you should ask them to treat you and not the doctors. That is because there is a lot of information which might be a problem in itself. Also, there are online compulsions. You want to play a game or you want to see if somebody liked the profile picture that you just uploaded on a social media platform. So these compulsive behaviors are a problem. But more than that, there can be self-destructive behavior where you are involved with gamings and all of that. So all that spectrum of problems can be part of smartphone addiction. The causes of smartphone addiction, basically smartphones gives you the convenience of size and portability. It is all the time with you, okay? And it is seen that when you are looking at the notifications on your phone and checking if somebody liked your profile picture on social media, it actually releases a chemical in the brain called dopamine, which is a part of what is called as reward pathway. Reward pathway is typically you feel happy when dopamine is secreted. So therefore, you start depending on somebody liking the profile picture, and that leads to alteration in the mood. The underlying problem, and these problems also get exaggerated when you are addicted to mobile phones, can be stress. You get into binge watching some serials because you are too much stressed and you don't know where to divert your energy to. Anxiety, depression, or loneliness. What is the impact of this smartphone addiction? There is increase in loneliness and depression. You are cut off from everybody. You are just being with yourself and the phone in your hand, and that is a problem. It can fuel anxiety, increase stress, and also lead to attention deficit. Also, a lot of times people are not able to sleep because they want to see what new things have come up, what binge watching the videos and all of that. So all that can lead to a lot of problems. So what are the signs? What are the danger signs that you should be careful about? There are actually no time frames or number of times that you should check the updates that will tell you that you are addicted or not. But if you start neglecting your face-to-face relationships, your work, school, hobbies, or other important things in life for looking at your phone, then you know that you are addicted to your phone. Okay? If you find yourself ignoring friends over lunch and want to see an update on Facebook or Insta, or compulsively checking your phone while you are driving or during a school or a college class, then you need to actually reassess your use of smartphone and have a healthier balance in your life. So what are the warning signs? You have trouble completing the task at work or at home, isolation from friends and family, concealing your smartphone use. You want to go somewhere in corner and check your phone. A lot of times, children, they are studying, but inside their books they keep the phone and look for things. Having fear of missing out, because if somebody doesn't like your Insta photographs, you feel that you are losing something. Feeling of dread, anxiety or panic if you leave your smartphone at home. You start feeling that some part of your body is missing. Then you are actually having a problem. You can also experience the withdrawal symptoms like restlessness, anger or irritability, difficulty to concentrate, problems with sleep, or craving access to your smartphone or other devices that you really want to. So what do? A common word these days is digital detox. So what you have to do is set goals for when can you use your phone. Turn off your phone certain times of the day, maybe while you are having food or you're having a conversation in the family. Just leave your phone away. No phone should be taken to bed. Okay, these days a lot of times we plug in the phones and then we keep watching them, so the sleep gets disturbed. Get involved with healthier activities, do physical activity, and sometimes it might be required that you remove the apps of social media or games. So a lot of times these things help. These days again, yoga has been used to actually manage smartphone addiction. So we will be talking about that when we talk about the evidence of yoga for attention. So in summary, what we have learned today is attention or concentration lapse is a very common problem. It is just out of boredom. There can be organic problems like ADHD, or because you are too distracted because of a smartphone. It can be also associated with physical or mental health issues, and it is important to detect these problems early so that we can quickly recover from them. So in the coming session, we have learnt about attention and concentration. We have learnt about the types of it. We also have learnt what areas in the brain are active. Today we have understood what problems can be there with attention. So how do we check how attentive are you, okay, or how focused are you, how can you concentrate? The assessment of attention and concentration is what we will learn in the next session. Till then, thank you. Namaskar.